Sorry. How we've been packaging the message for COVID-19 disease. Have we been effective passing across the message to the general public, to the healthcare worker? So we'll have Nancy Njoki taking us through that session. Hello, Nancy.
Hello. Hi.
Hi, how are you?
Nancy. Hi, namesake. Nice to be part of us.
Good. Now, are you alone or is Anne joining you? Is
I'm alone. She sent me today.
Fantastic. Today. Utaweza.
Nitaweza na pengine atasikiza. At some point she might join in.
All right. Yeah. So you'd like to maybe introduce yourself briefly, tell us something about you as you start the presentation.
Great. So good afternoon, everyone. My name is Nancy Njoki. I work with Population Services Kenya, and specifically on matters COVID, working very closely with Ministry of Health in terms of packaging information to get people to do the right thing around following guidelines that have been set up by MOH. Yes, so there's been a bit of thought process around that, and I'll share my experience on that and what it takes to get that to happen. Yeah. So I'll, if okay with Nancy, I can go straight to the presentation.
Yes, it is. You can proceed.
Okay. So, so this is us. I'll take us through some thoughts just to also help us discuss more and have a discussion around COVID messaging, and also appreciate the work that happens behind the curtains in terms of putting messages together as we proceed. So we know about this in terms of where we are at, and I know this will change. It tends to change every day. And also to see where the cases are. So we're on the other map where there's the map
Nancy,
of yes.
We can't see your screen. Please share your screen.
Oh, okay. Just a sec.
Okay.
Just give me a sec. Let me see. All right, here we go.
Nice. Now we can see it.
We can? Okay, great.
Yes.
Let me start from the beginning. We're good?
Yes, we are.
All right, great, thanks. So I was talking to the current status of COVID in Kenya right now, and where we are at. We know the numbers, and they keep going up, and I know the medics in the house know much more about that scenario, and we've been having discussions on that. The other map is just where these cases are in terms of mapping. We're in about 35 counties with known cases around the country. That has an influence on messages later on, as we shall find out. And of course, the blue areas are just where the containment areas are in. So just a bit of background as we proceed. I think to note, to start with, is that our behavior has really changed. With the stay-at-home guidelines globally, we've seen a lot of course, the buying. And I don't know if anyone of us did not stock their houses, yeah? We changed behavior overnight, yeah? And that we saw a lot of change globally in terms of consumers stockpiling, shifting to e-everything, including this e-learning meeting and this e-webinar. So there's a shift, there's a rapid shift on that. Just to show you, also to appreciate how quick and how flexible the human behavior can really happen. So we've seen a lot of e-dating, e-working, e-concerts, e-house parties, and of course, more professional e-webinars, like of course the one that we are in right now. And then even as consumers or as the end users, or even us generally, we are seeing how are we generally coping with this disease, how are we generally coping with COVID. Some are, they're thinking the crisis is out there, it's not affecting them, you know, and life goes on as usual. There's another one that is very keen on collaborating and accepting. But then there are others who are worried and are defending and retreating. Then there are those ones who refuse to be a victim. And then there are others who are very good in decision making and strengthening and leading. And there are others who are very apprehensive and keep strategizing and planning. So globally, people are on different cohorts. There are different dimensions in terms of where we are at. But there's need for scope and even need for us to to see how do you shift these people from one level to another. So that's what we also look at. And what does it take in terms of messaging? That we also look at messaging beyond that to actual behavior change. So beyond talking about messages to actual behavior change. So what do we know? Locally, we've had a couple of studies done by partners in Kenya. And we know some things around knowledge of COVID since we started the commercial corona campaign. 99 of us have heard about coronavirus, which is very high, very, very high. This study was done by KNBS. The source of information, we're getting a lot of media from radio and TV and print and mobile messages and social media. We know about protective measures, and I say the word no, not practice, the word no. And then hand washing, we know about using masks, we know about social distance, and the symptoms are also very familiar to us as listed there, including fever. Everyone knows about fever. And I know it's also a trouble on the other side because then there's also the issue of stigma coming up on that issue. And then there is also the issue of risk. Who do we think is at risk? And the youth especially have been noted to think that they are not at risk. It's only 1 in 4 people that perceive themselves to be at risk. So that's something that's worth thinking about, even when you talk about messaging going forward. Then, of course, ability to practice recommended behavior. There are challenges to that, including lack of water sources, and then they're not able to self-isolate. These are studies that came from informal settlements that we're also referencing. And then, of course, main concerns around COVID. People fear dying from COVID, maybe rightly so. And they also worry really much about the impact of livelihoods. But they really also don't worry about infecting others, which is something that we should worry about. And I know even Ministry of Health also worries about that. And they are really worried about economic impact of the disease, loss of income, and lack of food and water. So that's what we know. So because then even as we think about messaging, we need to come from a point of evidence. So because we are telling you something based on a gap we've identified, either in literature review that we are doing, so that it's bang on and it's to the point and actually becomes effective. So when you look at approaches to COVID, a couple of theories are out there that, would support some of the things that you're observing currently. So there's this theory called stages of change, or theoretical, that talks about where people are, like in terms of change, people change in stages. There's usually like a continuum of stages that people go through as they go through behavior. So the first one is pre-contemplation. You have no intention of changing your behavior, and then we come tell you something about it. You think about it, then you contemplate about it, then you start thinking of doing it, then you actually do it, then you maintain the behavior. You might also relapse. And I think one of the things that we're having a challenge right now is this whole issues of relapse. Because then we are being told we are going back to where you are. People are not listening. Oh, now we are not even doing the things we're supposed to do. We're not washing our hands, and not social distancing. We're not wearing the mask. We're wearing them on the chin. We're also always being told every day by Ministry of Health how some people tend to relapse. But there's actually a theory that says this is actually expected in terms of following this theory of thought and predicting behaviors. So this relapse can also support individuals strengthen their behavior in terms of going back to the cycle and going round again. So a relapse doesn't mean the end of behavior change. It's actually a process. There's a process, a circular process. So there's hope. There's hope for that as well. So when you look at messaging and looking at what messaging counts, like what is it that makes message counts? For one, it must command attention. You must listen to many things, and you must, if you don't remember a messaging, personally from where I sit, and I know all the effort sometimes we do, then if you can't remember, I didn't even communicate. So there's a lot of effort to ensuring messages catch your attention. And I know sometimes as communicators, we go a long way to doing this. In fact, right now, there's a lot of media going out on COVID. And I know one of the discussions we've been having with Ministry of Health is on the possibility of having a phase two on COVID, and seeing how different might we package this, because we are used to seeing the same thing packaged the same way. So if you do that for a very long time, it becomes almost wallpaper effect. You're not seeing, you're not hearing, or you're not seeing the difference. So we must command attention to exposure. The message must be clear. You must hear. We must communicate in terms of what it is that we're saying. What is in it for you? So I'm telling you, then how does that benefit you? If there's no benefit for a consumer in terms of what you're telling them, they may not approve of what you're telling them. And then the other thing that's very important is that we must have a hook on emotions. We must cater to the heart and to the head, and have this trust. This message is very trustworthy, so that you're able to act. One of the things that you're seeing a lot happening, even from private brands, is that we see a lot of medics, which is good, in terms of when they offer, when you're having something to do with offering services, we will see a medic, we'll see a doctor there. So because people believe that profession, so people must have that trust, and they must identify whoever it is that we are speaking with or on. And then there needs to be a call for action. What exactly do I need to do? Yeah, what exactly? So you've told me all these things. What am I supposed to do? So that all these components must be in a specific message. So message is not just a message, also looking at that, sometimes a message, there's a lot that goes into packaging a poster, there's a lot that goes into packaging a radio ad or a TVC, and those are some of the elements that really go into the message. So here where we are, individual's perception, like we are still crafting, even as we look at phase 2, and even look at how we've been working at Commercial Corona in terms of especially creating awareness on what the guidelines are, and how we are supposed to do them. I don't know how we are faring on, and of course this is something that we can also have input on. How susceptible do we think people feel? Like, do they feel that they're at risk? And you remember going back to some of the studies that I pointed out in the initial slides, some people think they don't feel like they can spread the risk, you know, and they think, and the youth even more so amongst the youth, they do not feel that they are at risk. So there's a problem perhaps right there. It's something that we need to, collectively even address as we proceed. There are some factors that affect this susceptibility, and looking at age, sex, ethnicity, socioeconomics. Do you even know what that is? Do you feel you're at threat? And what out there helps you feel that you're susceptible? Do you have skills to action? Do we have education going around? Do you see people, one of the things that I found interesting about this COVID is that for some reason, people don't know the person, people don't know somebody. COVID is sometimes perceived as one of the diseases that is for somebody else. Somebody's for somebody else. Like in your small circle of friends and family, you may not think that you do not know somebody, and that in itself brings up believability. So then people start saying the government is quoting numbers, where are these numbers coming from? And you've actually come across some influencers who are questioning the numbers. But then of course, we also know that this is something that is happening and is spreading. And then there's also media information. There's a lot of these. There's infodemics, as we call them, information coming from all sources, and all that affecting the likelihood of somebody taking up an action. But I think one of the things that we are saying is that as an individual, you'll have to make a choice if the benefit outweigh the barrier. Yeah. And like, remember the message, what is in it for me, especially, and likelihood of behavioral change is also affected for that. So it's also some of the wider frameworks of messaging and change that we continue looking at even as we change people's behavior, which, by the way, let me mention that it's one of the hardest jobs ever. And sometimes I just like thinking about personal behavior that we wrestle with, be it quitting to smoke, be it exercising every day, that you tell yourself today I'll wake up and run around the estate like I've seen my friends doing. And then when the time comes, you take the blanket even closer. So it's the same way you struggle with the behavior, especially when the benefit is not So it's not so important to use the same way anyone else will struggle the benefit, will struggle the behavior that is of public good. Something to think about as well. One of the other things that's very important, even as we say messaging, is who we are talking to. Who we are talking to becomes very important. We don't talk to everyone the same way. So we craft messages for different cohorts of the population. The way we'll talk to young people is a different way we'll talk to, mothers in the village, market people in the slums, they have their slang, there's a way they talk, there's a way they do it. So what you do in communication mostly as well is, and even what you're doing right now, is craft and profile the kinds of audiences that are important and that who are at the highest risk. I mean, you can correct me, but the last time I checked, some of the age cohorts that were very vulnerable to COVID were 30 years and above. Maybe that one has changed. I haven't seen the demographics of late, but it's very important so that even as I'm like as a communicator or as communicators and I think of messages across channels, they appeal to different audiences. But even by the time we come to that, we always take an opportunity to understand who we are talking to and get to know them on a very personal basis. So profiling is important. It happens across most brands. It happens across most communication platforms. And that is not different for this campaign. So for this campaign, even as we continue, we are seeing a lot of need around the middle cohort, around the informal, the peri-urban, rural folks in terms of the need and the disease burden around that. But when it was starting, you remember the first wave, it was a bit elite, yeah? It was a bit urban. There are the people who are coming by flight. So the people, then it was different. But now, right now, so the target audience is also shifting. As it shifts, how we craft the message that is appealing to them, it becomes shifts with time. So the audience who we are talking to is always at the center of our communication. It has to be at the center of our messaging. Because, for example, the pictures I've put there, those three people, you talk to them differently. If you have one message that talks to them the same way, it might just pass. It might appeal to one and not the other. So we cannot have the risk around now of talking to everyone and not talking to anyone. So that becomes very important. So there's a role of different channels that we also look at and why that is important. So after we understand who it is, and you've seen a lot of media differently, in different places. I'm sure if you open your TV, there's a way it's being packaged and it is well targeted for us. If you open your TV, it's targeted for you. And then if you go to the social media, it's targeted for that person who understands and who's a fast user and is, has everything. Who is a digitally. In fact, nowadays what we've seen is a lot of multiple media consumption. So somebody's watching news, but they're already on the social media. They are watching and they're commenting and so things are changing even in terms of how, especially the young people, consume media. So we have radio, we have TV, we have audio, we have SMSs, some of the main channels we use for our messages, and we've seen this across board. And we'll continue seeing this. What will change is the message itself and how that changes. The other thing that we've also noticed about messages around COVID around now is how fast-paced it is. In the past, when we talked about any other of the disease areas, say HIV or malaria, we'd have one communication running for a year, But now we are talking about within a span of a month or two, it's changing because the things, the nuances of this communication and what people's issues are is happening very fast. So the pace is also happening very fast. We might be talking about something different come next month or 3 months from now, and you must adapt to the time. So the channels stay, but the messages will continue changing as we go ahead. This is just some slides, some initial slides in terms of what's changing in Kenya, in terms of TV viewership. There are more people watching telly, actually, especially in KTN, Magic East, Switch TV has had a decline, or Magic East has had a decline. The thing about also messages, you have to see who is where. We go for majority of people, what are they listening to, what time? And we've also seen a lot of content-driven messaging. Like we are likely to book media, a lot of messages around the news. So I know we always complain, like when you're about to go news, you see all these ads coming around news time. But that message is important because they know everyone is on their sofa watching news. A lot of messaging around maybe when our minister talks about updates, because we know most people are watching. So we follow the listenership, and so for even for communicating on messages, it becomes very important to follow trends on consumption across cohorts of interest. There's been a drop on radio, and people have become more visual as we go ahead. And this is data we get from Geopol, who are some of our partners in the communication industry. But that said, that's still important, because sometimes we still listen to this. If you see the growth, we've seen a bit of decline across most of the stations. But there's still value for this. It's just that the world is changing, and there's been a change. And one of the things that's attributing to this is the whole idea of home media. We are doing more things. We're watching more movies from home, because you're at home. You've been asked to do at home, you work from home. So there's a lot of home growth. There are home media happening, streaming live things, using apps on the phone that is really increasing. Binge watching is happening because some have the time we don't know what to do with our time. But yeah, so there's been a lot of home media as we proceed. So going forward, then we expect also to see a lot of messages happening on the home media front, even as we become very tactical in terms of what we are saying, to who, where, and when we are saying that. This is just radio, just to show some of the stations that are doing well. So for us, especially at PS Kenya, we are very keen on the reach and the affinity. So it's one thing for you to have very high reach in some of the stations. Affinity is the love. There are people who will switch on stations. Within 1 hour, you've switched across 3 stations. But there's somebody who will just be on one station. So that's what we refer to as affinity. We'll be on one station for quite a while. So this balance for us becomes very important, even as we craft messages going forward. So it's important to have the message, but it's even very important to place it where there's reach and there's affinity, so that we can actually get across the target audience we have identified for impact. We've talked about this, so I won't go much into this, but then it's very important for us to see which stations are leading, and there's always studies being done in terms of who's leading. And so you'll find a lot of advertisers going for the stations, for example, that are leading. There's also what happens, we call it out of home. We'll find a lot of messages. I haven't seen a lot of this, but then I know going forward, this is something, even as PS Kenya, we are very keen on supporting. A lot of out of home outdoor, especially with the, with us envisaging opening the up, some maybe past 6. We will find out if we've opened up the economy a bit more and we're able to go outside a bit more, then we are likely to have opportunities to talk to people even more. Because sometimes what we say, it's not enough to just use one channel. We talk about even up to 6 exposures of the same message across the same target. And this is because we know from theory that people are different in terms of how they consume, people are different in terms of how they take. There's that one person who will listen to a radio or see a billboard and they change their behavior. Yeah, but there's that other one person who will not move. We call them, there's a theory called diffusion of innovation theory that talks about the laggards. Those people need a community health volunteer going to their house and convincing them why they need to follow MOH guidelines. So messages also take time across different people because behavior sometimes can be very complex. So cognizant of that, you will find multiple media channels being on the same message being there. So you'll see something on TV, you listen to it on radio, you go on the road, you will see it, and then it just confirms and reaffirms something. So and by the time you get all these channels, getting that message right becomes very, very important. So when you talk about out of home, this is what you're talking about. And I know going forward, this is some of the efforts in phase 2 of the campaign that we are really supporting the ministry with. Is gonna get better at as well. Bus stations, as people wait for matatus, inside the matatus, at the ferry, at the coast region, where we may have a lot of commuter and traffic, human traffic, but they have opportunities to interact with messages. And then of course there's social media. Social media has really growth in depth and bounds. As we said, home media is happening, everything is happening. So that is also becoming an increasing platform, but not for everyone as well. This is particularly important for the younger cohort below 30, especially because they're very quick on social media. And in fact, going forward, one of the trends we are seeing is they're less glued to the traditional media. Like, you'll not find young people watching news, like watching TV. They're likely to get that one from their phones or the home media I talked about. I wanted to mention this because this is very important. We've seen it from studies across board, that the role that the health facility or the health provider is a trusted source. Akisema nitatenda. So this gives us an opportunity to really reassure the consumers or the clients that you come across on the need for following the guidelines. I know one of the shifts that the ministry is very keen on is also really talking about why are we doing the things we are doing, and we will be seeing how that will be packaged in terms of messaging. But why are we doing the things that we are doing? Why is it important? Because there's an understanding that you've done this on the how. We've been very good on the how, but then it's time to also get good on the why. It is really important going forward. For some of the EC materials that we've had, this is what ministry has, and WHO for providers, and hand washing, especially for consumers. And these materials are available there. We have links for that. We're happy to share links on this as well. But this is going out, and I think one of the key benefits of rallying behind a campaign like this is that we're able to become efficient in terms of what we are saying, and how we are saying is standardized, and it has had all the technical eyes in terms of what we are saying is exactly what is supposed to be said. And then the how, we can always be creative in terms of how we do it. Yeah, so that the support materials are there, but also know there are a lot going out there that are not exactly sanctioned. I know WhatsApp almost shared them, but maybe I did not want to be quoted. But there's a lot happening also. We've had a lot of forwards, for example, on WhatsApp, on messages. And I know Kenyans are very creative. They don't get boring, not at all. They create things and what have you. So, and that's what I talked about, the concept of infodemic. So there's a lot going out there. So, but as mainstream ministers and key supporters of Ministry of Health, and we advocate for what they're also pushing, so that we are also part of the change process, and also coming from a point of trusted sources. Because whenever we see the government logo, whenever we see WHO logo, it's already a trusted source, and we want to continue on that belief with our audiences. So that's what I had in terms of presentations, and I'll take it back to our host so that we can proceed from there.
Thank you very much, Nancy, for your good presentation. A lot has been communicated to all of us. So we'll open this to the question and answer session. Anyone who has a question can raise their hands, and we'll be able to see the hands that are raised and allow you to speak. In the meantime, I'll ask the question asked by Teresa Kinyaru. We've been discussing about stigma associated with being a COVID patient, and that is something that's affecting a lot of the patients and even the healthcare workers. So the question is, how do we develop messages to reduce stigma associated with being confirmed to be COVID positive to improve health-seeking behavior?
Hi, yes, so true. And in fact, yes, so the stigma is becoming one of those things that we need to think about. And know what comes to people's minds is what we see when we see like a suspected case in the community. So we see all these people in overalls, and I'm sure there's no other way, and I know medics in the house will agree, there's no other way of doing it, but it doesn't help. Even how it's done doesn't help in terms of addressing the stigma. So yes, I do agree there's a need for us to focus on that. And so going forward, we might look at a bit of testimonials as well in terms of hearing from people and, you know, having influencers also perhaps also adding in that, and keep talking about that there's no need for stigma, and even how we handle them, how we package the people who have recovered becomes very important. So yes, I do agree that stigma is there, unfortunately, and it needs to be addressed as we proceed, especially in the new phase, even as we open up, so that we know that this is something that we can overcome together, collectively, individually, and also collectively.
All right, thank you so much for your response, Nancy, and thank you so much for that wonderful presentation. We truly appreciated it. Let me give it back to Dr. Nancy Ngumbao to continue.
I will, okay, so thank you very much for that response. I will ask a question that is being asked by one of us. It's anonymous in terms of, so it's actually being asked by Michelle Chayuga. How can people in remote areas get sensitized about COVID, especially amongst people who don't have access to radio or TV? How do they get the information that can keep them safe?
Yes, so there are those pockets of for the population that don't have access to radio and to mobile message and phones, and I also want to believe that that's also not very many people. Then of course there also the challenge that comes where, because some of the key tactical places they've used is the clergy or the places of worship, and there's also a lock on that one. And then they've always a lot, you know, the places where people converge in some of these remote areas, and they're also the places that have either been closed down or we are being discouraged from going where there are many people. But I also know the ministry has also availed guidelines on how to continuously use community health volunteers, which is a resource across the country in terms of spreading the message around the key guidelines, the key behaviors that we need to do. So in my opinion, that remains a key resource. It remains actually one of the most sustainable resources that we have as a country. The use of community health volunteers, because they are mapped to every household in most of the counties that we are in. So for those cohorts that are not there, that is important. Also, there's also the administrative side. There's your local chief. I know in some of these urban areas, like for personally, you know, I hardly go to barazas. I don't know how many of us go to barazas. At our level, we are very urbanite, but in some of these rural areas, that becomes very important. The chief is the one who is the influencer. He says he says very influential, in short. So avenues like that also become very important to talk to people, because then he can always use the elders. So those are some of those traditional mediums becomes very important in areas where media is a challenge. So what we do in communication and messaging is ensure they have a package of information. So there's a lot being done by partners in terms of packaging. There's a lot being done actually by Ministry of Health also in ensuring that there's a package available for each of these mediums. So that if you need it, then you actually have access to this and you're able to say the right thing to the people that are in need.
Thank you very much. I'll allow Tabitha Kiberenge to ask her question. Tabitha, you can unmute yourself and ask your question.
Hello. I wish to thank Nancy for the good presentation. Yeah, actually, I've really learned so much from that presentation.
Okay.
There is a poster that you've just displayed in your last sorry, what is it called? The last
slide.
Yes.
Okay.
In the last slide, sorry, that's what the word I was looking for. In the last slide, which says comesha virusi vya corona hakikisha wananawa mikono. Actually, I have an issue with this word wananawa. You know, when I read that, wananawa ni watu wengine, sio mimi. Yeah, so actually it lacks ownership. You know, when I read it, actually it's supposed to be communicating to me and not other people. So hakikisha tunanawa mikono. Wananawa ni watu wengine. Secondly, I want to thank the government and partners who are really assisting us in developing the messages, the posters, all the IEC materials. And I've realized there is a gap. There is this group of people living with a disability, especially the deaf and the dumb. They are left out in our messages. How can we assist this community so that when we are talking when we are talking about this coronavirus, we are at par? I know the media is doing something because we have a translator, but at our level as healthcare workers, at our level, how can we be assisted so that we communicate effectively to these people living with a disability? Thank you.
Yeah, so thanks so much, Tabitha, for your input and your your advice as well. So there were a couple of posters. I didn't go through all. Actually did make an assumption you've come across most of the IEC materials that have come from Ministry of Health, but nevertheless, I see where you're coming from in terms of saying this poster is for other people. So there's the component of me as a caregiver having a role over my children or the people in my home in making sure they are doing something, but they also need for a focus on me as an individual. So and that is something actually that we are thinking of getting better at going forward. So the next phase of support or campaign will have a lot of individual responsibility as an aspect of focus, so that as you correctly say, people don't see or don't view this communication as in ya watu wengine, si yangu, nini mnaambiwa, me, I have no role in it. So as you well put, it is something that is being looked at and will change some of the messaging going forward. You'll see a shift in that, because it is definitely something that the ministry is very keen on in terms of ensuring that there's individual responsibility going forward. Yes, on your point on disability, I really couldn't agree more. I know there's an influencer video we did for disability. We're happy to share. I'll share a link on the messages of some of the videos we've done that had that supported that, but that's not enough. I think there's need for all of us collectively doing something in that space to support the ones who are less fortunate in terms of accessing the messages that are in the mainstream media. So I definitely agree that there's room for improvement and that you can do more in terms of supporting that.
All right, thank you very much for that response and for the question, Tabitha. We have Angela Maina, who would like to give a chance and an opportunity to share what they are working on. Angela, hello.
Hi, how are you?
Very fine.
Good.
Yes, maybe you can share briefly. I've seen you in the Q&A section, you wrote in detail about the work that you're doing in terms of communication. So maybe you can just share briefly and how people can also be able to contribute to this communication, because I'm seeing quite a number of questions related to home-based care. Somebody's asking, how can we package the message for home-based care now that to reduce the stigma, to enable these patients to be able to get support from their relatives? So how do we package that? Maybe you can share the work you've done around COVID and any other area, then we can learn from that.
So we're social mobilizers. We've never really worked on the health issues before. We've always done peace and conflict, social healing, mental health work. But we've always worked with Kenyan illustrators, painters, who paint us pictures where people can feel and see themselves inside the painting. And early on, as the COVID response started, we saw very early on that there was a need to bring this kind of messaging into all of the different other messaging that is happening. I'm married for 20 years to a Kenyan who doesn't read. He looks at pictures and he understands everything through reading, through pictures. And so we started to develop images and pictures where people could see themselves, see how to live. We've done a number of series of how to wear a mask, why to wear a mask, how Muslims wear a mask as it's different. And we have high populations in the Muslim communities who are being impacted by COVID-19. How police officers should wear a mask, how police officers should treat people, all of these different things. And we've packaged these. We've also done some issues around stigma. We have one very nice sequential story that talks about somebody who went to mass testing, came down with COVID, got sick, went to hospital, got well, and came home, and her neighbors celebrated her. So there's some different ways that we're doing it, really showing what it means to be a Kenyan and to be Kenyans that can live with this, because we're going to have to live with this going forward. And how do we do this? We've also got all of the materials are in open source. They're on a Google site. We upload 4 or 5, maybe up to 7 different images every week. We're always looking for new stories to start to tell. We're starting to focus on telling stories around how to live with COVID from a disabled perspective. We're also looking with the Water Board about some of the things that they want actually out in the rural areas. We're always keen on people telling us the images that they would find most useful, and we can help develop those with you. We work right now with 5, but we're moving up to 7 illustrators. And we're in touch with the CDC and Ministry of Health to make sure our health messages are on point, because we're not health folks. We're also working with the National Prisons, the National Police Service, and hopefully soon the prison office, because there's also a great concern in prisons. And we're always open to collaborating and hearing from people about what you'd like to see in the images. And I've put in the question section the Google site. You can tap onto that. We're right now looking for people who could translate to Kalenjin. We're adding Maasai and Kisi today, and then I think we've got most of the major languages in Kenya already covered. And one of the things that we always do is we add English to the vernacular language, so that we know that people will read in English, but oftentimes speak in the vernacular. So we're trying to give people the right language to use in their vernacular as they're talking to people who really need this information, but maybe won't look at the picture or will only hear it from trusted sources.
Thank you. Thank you, Angela, for the work that you're doing at the community level. We truly appreciate that. And we appreciate all the efforts everyone is putting in their own little way and in the limited capacities that they have, but we appreciate that. Even the fact that you're translating it into the local dialect, it's very encouraging. Now back to Njoki. Nancy. Hello, Nancy.
Yes, I'm here.
Yes, we've seen a lot of adverts. Apart from the poster material that you've showed us, there's quite a lot of advert that goes on at around 9 p.m. during news time. There is the most recent one I saw is the Choma Picha. Una Choma Picha or something like that. Una Choma Picha. There's something about the youth. And yes. Now, I don't know, when you're talking about preparing the message, now you said 1 in 4 youth perceive themselves to be at risk. So we have like 3 of them who don't think they're at risk. They don't think they'll get unwell. Yeah. Do you think that the way we package some of this message, especially to the youth, and that message is out there, but we saw what happened over the weekend at a popular local joint in Langata, where the youth actually went out, and they all went all out. So this messaging, as we package it, are we able to get their attention, the youth attention? And the time we also present it at 9 p.m. Are the youth watching TV at that particular time. So can we talk about how to present message that targets the different population? For us who watch news, or for the elderly population that keeps up to date with the news, most of them, if you find out, they will not know what that advert is all about. I'm sure if I ask my parents or even somebody who's slightly, they're not aware what that advert is about, but they'll just watch it because they're waiting for the next segment of the news. Yeah. So for the people, the younger generation, how do we target them? The children, the youth, how do we get them to also understand that they're at risk, so that this 1 in 4, we're able to make them realize that they can actually take the infection to their parents. They may not have the severe disease, but they're likely to carry it to their parents and give it to them and cause dangerous impact. So how do we package that?
Yeah, so thank you for that question, Rhoda. So my input on that is that even as, you know, SBCC or communication practitioners, there's been a shift in terms of how we put messaging together. We are coming from a point where we used to tell at the youth, or we tell at our audience, to a space where we are doing co-creation. There's a new movement. There's been an emphasis around human-centered design. So you work on messaging with the target audience in the room. So, for example, if the issue is around how we are packaging, the issue is around where we are placing, it will not be an issue because you understand from them where they are. Remember when I was talking about my target audience, and you understand the whole cyclic touch points of how they spend their day, what they're concerned about, the things that matter to them, the places that they hang out, if their media habits in terms of consumption. So there's need even for us as communicators, and even as we do about messages, to spend quite a bit of time with our target audience, to understand how they view things, to understand how they consume things, and to actually co-create with them. So I think sometimes we tend to just go to the boardroom and go put some message together and voila, we take it out. And then the other thing I always find very helpful is that this communication is not for me. You know, sometimes we feel like if I don't like it, they will not like it, yeah? So removing ourselves from there if you're in a space where we're doing messaging, because you are not the target audience. So even if you're not have an opportunity to co-create because of the limitations of the current environment, then we always advocate for pre-test. These messages, actually communicate what they're supposed to do, because sometimes what you say is not what people hear. Yeah, you say one thing, you intended for one thing, and then the consequences of your communication become something different. And you've seen that. What do you call it? We call it boomerang effect of messaging. So you say one thing, and the people get quite something else. Sometimes even goes out of context, and we've seen that happen. So what I'd say on that is that there's need when you're doing messages to have the audience in the room. If that is not possible, once you create something, ask them, what do you take out of the message? Do they even find it appealing? Is it talking to them? And then of course always, and these studies are out there in terms of what are the youth doing, where are they doing it. If you look at media reports in terms of where the youth are at, you'll not find them at the 9 p.m. news. Most of them are on their phones. Most of them are on their phones. Most of them on WhatsApp and those aspects of social media. So it's also about spending a bit more time in terms of understanding where our youth are, and then finding them at the right place. One of the other challenges I know across many people is reaching children. I think for now, we tend to reach them through their caregivers, because then we have access to their caregivers. One of the key channels has been the school platform, but we all know the current challenges around that. But even as the economy opens up, then that's also a space that we can directly look at, because there's the school health policy, and that's a very great avenue that the Ministry of Health has put together for reaching these children and reaching them with messages that have already been vetted, and that they've already have gotten in the buy-in of teachers, the buy-in of all the gatekeepers and all the key influencers, if I say so. So I think it's just ensuring we do our homework well when it comes to messaging, and ensuring we are packaging it to the right audience. One of the key things that I've seen, we usually run some youth campaigns back at PS Kenya, and usually target their music shows, the ones that come, you know, and half the time I can't even watch them. Maybe I'm elderly, Rhoda. I don't consider myself elderly, by the way. Eh? I think I'm still young, but I'm not as young as this next cohort that's behind me. Yeah, they're on a different wavelength, and I need to keep lanes. You know, respect your lane. So then they're on a different lane. So there's a way they listen to a lot of music, and so you'll find a lot of advertising also around that time when there's a lot of music. There are some stations that do music only the whole day. They used to, I don't know if this stuff is still happening. So there needs to be a bit of profiling this audience, just understanding exactly what gets them to tick, and of course talking to them accordingly. So yeah, just a bit more homework on the target audience if it's the youth in this case. Yeah.
Thank you so much for that, Nancy. And I agree they are at a different wavelength from us. And you mentioned something very interesting about social media and the youth. And I'm seeing a question from Gideon Kimtai. And Gideon is basically talking about verifying information about COVID shared on social media. Now I know it's a personal responsibility to verify information that is shared. But now you find that is what is trending in the youth, with the youth rather. They'll see something on Instagram and they'll forward it to their friends. They'll see a meme and they'll forward it to their friends. So probably as we open up, we need to find a way of packaging, or as we reopen, we need to find a way of packaging this message so they still know they have to adhere to the public health measures that have been put in place by the government, so that we don't undo the good that we had done. But thank you for that. I'll allow Catherine Muya to give a comment or ask her question. So Catherine, Eunice Maina, or Erica Chesa. Unmute yourself, ask your question. Then,
Hello.
Yes, Eric. Hello, Eric.
Can I go first, please?
Yes, go ahead.
Yes, good afternoon.
Good afternoon to you.
So I actually have a comment and then a question. So the comment is that music has actually been an important tool in educating people, especially in matters health. I'll give a few examples. When we had HIV, Franco did a song, Attention Nasida. When Corona came up, we have seen musicians in Tanzania, compose songs. We have seen Kofi compose a song. And I think that music could help passing these messages to people as a complement to the adverts, because not many people pay attention to adverts on TV and on radio, because not everyone, I don't think that you'll turn on your radio or TV to listen to an advert. An advert is just something that comes in between the business. So then I think that music would reach all the ages, number one. So if it's possible to focus there, especially in our space in Kenya, and going to our communities, is it possible for us to have our songs in the languages we understand? Those songs will speak to people. My concern or my question will come in this area now, that when you look at TV, for example, you have messages that are coming in as adverts, but then shortly after that, you get into the news and you get a content that is actually overturning every other thing that has been said positively. You see stories where people are being harassed in quarantine. You see people who are trying to avoid because they think that this is a detention. So you have a perception that overrides the message that we have had. Is it possible for us to have more messages, especially audiovisual messages from quarantine centers, for those people who are willing? Because I recently saw a group, I think I was saying from Kibera or something, I don't want to profile anyone, but they were dancing with the nurse and the healthcare specialist. And that was encouraging. It looked like this place wasn't doom and gloom as it looked. So is it possible for us to have such messages come up more often so that they drain they drown the negative content that we have been receiving in news? Yes, thank you.
Okay, thank you. Thank you for that. Nancy, would you like to address that?
Yeah, thank you so much for your input, Eric. I agree with you. Music, there's something about music that gets to everyone. I think my only comment on that would be now, it's definitely a very good tool. It's an additional tool that would help a lot. It's just now ensuring we got the right genre for the right target audience, because then again, we may not have one song appealing to everyone across board. Also because people are different, they have their version, they have their genge and their, and then there's a pendua for our folks back home, and for us, hapa katikati, I'm not really sure what gets to us nowadays. Maybe we are a mix of both, but then there's need and there's an opportunity right there to see if additional media content can help us, go back to the guideline. If it's going to help us shift behavior, that's definitely something welcome. And I think going forward is something that we definitely need to look into. Around your comment on TV messages, I agree. I know every advertiser out there who has something to do with, with the key elements of use, be it a sanitizer, be it hand washing, or things with hygiene. We'll collaborate. We'll infuse messages on COVID, because there's also their interest as well that they need to take care of, and I think it's a good thing. But I think there's need for us to have coordination, which is something that the ministry is currently offering across board, even across the private sector. So that coordination, that standardization is important, so that at least we're saying the correct thing. The thing about what comes after in news is something else, because it's a discussion that you continue having with our media partners in terms of, the stories they tell, the images that they come. And also from them, they also have this angle of what the stories that have to sell. And sometimes, often, Kenyans, you're also a reflection of that mirror. We also like consuming the kind of negative media. We tend to consume better and chat more and have more likes around it. But I think there needs to be that shift of also positive media reporting, because then that one definitely does set an agenda for conversations in the country. So that's an ongoing discussions. I know as partners and I know as ministry, there has been efforts to do a lot of media training. I know in some of the program areas, we've done a lot of training on media. So if you're having like a new launch on something, we bring media together, we talk about it, and we say, kindly let's talk about this. This is about, so that we also don't have myths being posted out there on the main channels. I think it's work in progress, and I think if we can do that from each of our efforts, then it's something we're gonna get there as well. Also cognizant of all these other competing angles. I think it's work in progress, and there's definitely a need to see if there can be more balanced media, especially editorial that goes out to the public, because it tends to erode. Yeah. It's one of those discussions that's hard to have with media, but it is happening. And even as Kenyans, the more we demand on positive media, and I personally see that when I've come across some stations where they have this liner or this topic that they are talking about, and people on social media were like, no, you're lying, stop telling us this, we want positive things, so increasingly Kenyans also becoming very vocal, and we are telling them what we want positive news. So I think it's a matter of time. I think with time we're going to shift the tides, talk about a balance that works for everyone.
Okay, thank you for that. Now, most of the media campaigns that we've seen it is our local artists who are on the forefront, especially the ones that are on audiovisual. You'll find either Njugush or Kate Actress. Who else has been there? Let me see. Oh, okay, I can't remember. But basically, it's a few local artists that are doing that. But there's a big group, and I know they have quite a lot of followers. They're very influential. They have quite a lot of followers, and in all their platforms. But there's this team called the bloggers. I don't know how best to call them, but I know some spread propaganda or not. Yeah. But as we choose the person who's going to be the picture of this information, or the person who's going to be the person who is representing the government to spread the information, maybe it's about time as we think about doing a second wave of messaging, we might think of involving some of these people who have quite a number of followers and are not local artists. So thank you for that. And there's a comment from Barry. I'll take this as a comment and I'll put it as food for thought for everyone, because it might not be easy for Nancy to answer this, but we'll give it a try. And Barry is saying, it is quite obvious that citizen TV and radio networks are leading in dispersing information and hence knowledge to a great proportion of people, both locally and in the diaspora. KTN TV and radio networks follows, I believe. The government TV and radio networks are doing badly. So I'll assume that's KBC, and maybe if there are any other government TV stations. So he's asking, what strategies can the public offer to help the government catch up and lead in dispersing information? So this is a personal responsibility, and what he's asking is, as an individual, how can I help disperse this information? How can I help people catch up in my local community? So Njoki, Nancy, we will not delve much into that, but there's a comment from Caroline Mwangi, and Caroline was saying, she was asking, what are the strategies in place to educate communities to increase the healthcare seeking behavior? Because we focused so much attention in the last 3-4 months, we've focused all our attention on COVID-19. So there's been a drop in immunization of children, treatment of sick children, antenatal care, people going to hospital to deliver there. So how can we change the messaging if we're going to have a second wave, or if we're still going to continue with the messaging? How do we also encourage people to leave their houses and come and seek care in hospital? Patients who have cancer, patients who are on hypertension, clinics who are on follow-up for diabetes. How do we encourage them to continue seeking care?
If I can comment on that, yes, I think there's been quite a lot of, focus on COVID. It's the new hot thing, the new kid on the block. And rightly so, there's a lot we don't know about it. So of course it creates momentum, and it's an interest by itself. And there are all these offers, by the way, in terms of, oh, I'll give you a bonus. Anything on COVID tends to get a lot of mileage. Even with ministry, to some extent there, they had really prioritized working on COVID and, getting the guidelines right. And, if you're working closely with the ministry, you also felt that is the way we are going. But then there's also been a shift of late in terms of integration, and there's been guidelines sent out on essential services and how we should go about, ensuring that all these other things don't fall through the cracks. So I've seen an integration. I know when we were working on World Malaria Day recently, there was an integration. We integrated the need for fever seeking, even though we are cognizant of COVID. So I think that would be the direction going forward, so that we don't lose track. We do not undershadow or underemphasize the need of COVID messaging, but we also don't fall back on key messages, on key areas, key disease areas we've been very keen in terms of talking about, and also following the guidelines that the ministry has set out in terms of what we need to do. So I think, yes, there needs to be a balance there. Otherwise, we'll definitely go just, all the things that we've worked so hard for so long, will just go down the drain, unfortunately. So there's need to balance that going forward.
All right, thank you for that. We'd like to hear from Dr. Wambani. Hello, Dr. Wambani.
Let me unmute. Thank you very much for a very good, informative talk on communication. Mine was just to add on something. We keep on saying that the youth are many and they don't seem to be participating. But before this COVID lockdown, I think I attended some youth cultural culture and arts that was being done at the National Theatre. And I realized that the youth have a big potential of communicating. I think we can use them in terms of music, poetry, dance, and what they call slam jam. Slam jam. That is what I actually attended at, and I found it very informative, very cultivative. You just get glued on and you don't want it to end. And I think we can capture our youth through that if we really want to capture the youth. Thank you very much.
All right, thank you for that input, Dr. Wambani. Eunice Maina, Catherine Muya, Cyrus Kivaku, Aaron Nyandika. Would you like to ask a question or give an input? Okay, so we're seeing a few raised hands, 6 raised hands. If you've raised your hand and we've allowed you, okay. Yes, Cyrus. Okay. Hello, Cyrus.
Hello.
Yes, we can hear you.
Hello, how are you?
Very fine.
Okay, my question. Have you seen my question?
Yes, but you can just ask now. Feel
What
free.
I was thinking about, other than other opportunistic infections that do cause the mortalities. Hello.
Hello, yes, we can hear you.
What other complication does corona have?
Thank you, Cyrus, for your question. We appreciate it.
Yeah. Like the question is, all the reports we are getting on the social media is that the patients have other infections. That itself, without other infections, is the patient safe without other infections?
Okay.
Yes, that was my question.
Thank you. Thank you for your question. I am not very sure if this is the correct session to answer that particular concern.
Okay.
Yes, because we're talking about communication, and Nancy Njoki is a communication specialist. But
Okay.
we will pack it until on Monday when we have a clinical session, then we'll be able to address it.
Thank you.
Is that okay with you?
Okay, thank you.
Asante. Eunice Maina and Catherine Muya. All right.
Okay. The other question I would like to ask is, right now we are moving towards home-based care for COVID, especially symptomatic, like patients who don't have symptoms. So Isabel Maina is asking, how do we craft messaging around this to ensure that it is integrated well? And even moving forward, is the messaging on how to help integrate people back into the community after they have completed their quarantine days. So how do we craft our messaging around this?
Thank you, Eunice, for that question. Yes, so there's a lot happening at the same time, and yes, so we keep challenging ourselves to get it right and to craft it. And I think this is going to be an effort across border amongst the sector. So home-based care, it is something that you definitely need some support in that area. And I know there's like there's a subcommittee at the ministry where I sit in as well, and we'll look into it and we'll definitely put something together. I think going forward, there's a lot of effort on the new normal, and how do we individually and collectively align ourselves to that. So the new normal is that the things will be, it's not a seasonal activity. It's now the new world going forward. And how do we get people to shift there? We're not saying it's going to happen overnight. It's unlikely to happen overnight, but with time, we will see the shift, you know. So I think messages going forward need to speak to the new normal, need to speak to the idea that washing hands has to become a behavior, wearing of masks and this social distancing, all these things is the new way of living. And how do we work around that? And how do we get people to get accustomed to that? So I want to appreciate that it's going to be a process to getting everyone there and to getting everyone on board, but we've got to start from somewhere. And I feel like, especially after we get the new direction, after 6, there's a lot of talk that some of those measures will be lifted. If that happens, then we'll start, and you'll just start from somewhere. One of the things that I've also noted, like in the new wave, like when you were saying what is corona, people didn't get it. But just 2 months down the line, if you look at current studies in terms of people knowing what this is, who's at risk, what are the symptoms, yeah, people have gotten with it. People tend to behave, especially because they know they're saving lives, because it's something that one of the insights we got from the studies is that they're fearful for their lives. They care about their livelihoods and what have you. So even going forward, and we say this is the new normal, how can we hook up some of these benefits that are very keen on people, that people hold closely to their heart, to their head, and they see that this is a benefit that I'll get. I need to do the right thing so that I either go back to my life or go back to how my life is. This is the new normal. That's what I'd say, so that collectively, as we do things cross partners and even coordination through ministry, we remain focused on the future, because this is likely to be here for a while, right? And I know the team from Rhoda and team can affirm that. So the new normal, these are the behaviors that you must adapt to survive in the next phase. And we definitely need to look into that going forward.
Thank you very much, Nancy. And as you said, this is now the new normal. So I will ask the questions from Linda and Robert. The similar questions. Now that we know that this is the new normal and probably this will be the way of life. Currently, there are a lot of people around who believe that COVID is not real. It's a propaganda from the government, so that I don't know, people should, so that the government gets money, and these issues are being discussed even in the public, maybe because none of their relatives have been affected. So how do we package our messages such that everyone understands that COVID-19 is real, it's reached Kenya, and it can actually escalate. And even as we are going forward towards tomorrow, where everyone is thinking, will the lockdown be lifted? Will it not be lifted? And assuming it's lifted, how do you message it to people that the coronavirus is real, and going beyond that, people still need to take care of themselves?
Yes, so there's a lot going on there, and yes, and this is work in progress, and we're also figuring it out as we go along. So I cannot definitely say that you have all the answers, but we seek to excel in the things that we are doing as we proceed through. Definitely work in progress. We hope, and I know, like most of our circles, we don't know anyone who's been affected by COVID, and I hope it doesn't get there for us to have the realization that these things must be followed, and we need to follow the guidelines as said. I really hope we're not waiting for that. One of the things that we have been discussing is that there's need for us to address risk perception and risk severity and susceptibility, that I am at risk, I can infect, like it is closer home. It is very close, like it can happen, I don't know how many of us have seen, there's been like a package of messaging going around on social media, WhatsApp, about this COVID face. So you'll find a face in a matatu with COVID dancing, or you'll find it in there's been just to show that it is here and with us. And so I think there's also need to focus on that factor of communication, that there's an element of risk that still not been gotten yet. People don't think they'll get it. They think it's for people out there. And I think that is definitely an area we need to talk about. We need to say it more often, more frequently, that, we are at risk and you need to do the right thing at the right time. Yeah, so I really think it's work in progress as we potentially open up the measures.
I'll give an opportunity to Monica Mochama or Abigail Magen, Haron Nyandika to ask their questions. Kindly unmute yourself and ask your question.
Hello. Yes, hello.
Hello, we can hear you, Haron.
Yeah, I've already asked the question in the QA platform. I've summarized it in the QA section, please. You may answer it from there, please.
Okay. Thank you very much. We'll ask the question. In the meantime, Monica Mochana or Abigail
Okay,
Mangen.
thank you for the opportunity. Hello, can you hear me?
Yes, we can hear you.
Yeah, my question is surrounding the messages that go around in social media. And I was just wondering, like the authorities, is there any regulatory body that could be tasked with the authority to actually screen the messages for truth and also avoid misconceptions, or is social media basically out of such regulations?
Yes, hi. If you follow news, we've come across some of the people who've been put behind bars. I personally have come across cases where somebody took somebody else to prison based on evidence on an SMS, for example. So I know there are acts and I know there are regulation against that were passed recently, actually, that prevents people from, spreading false information and what have you, and especially a huge chunk of that being rested on like an administration of a WhatsApp group and what have you. But of course, it's one thing to have acts and guidelines, and it's another thing to implement them. So I think for me, what it would go back to is individual responsibility, and to what extent can communication play a role in that? That you're responsible that you're responsible for your family, that you're responsible for immediate family, for your family and friends, in terms of what you are sharing. Yeah. So usieneze uvumi, and eneza ukweli. So there are things that we can talk about and also get to convince people who are trigger happy, who are button happy, I guess, in this case, in terms of just sharing, and that's how they come alive in their own sense, in their own sense of the word. So I think for me, I would talk about individual responsibility, definitely, so that you're not part of the problem, but you become part of the solution. Yeah.
Yes, thank you very much for addressing that question. Abigail Magen. Abigail Magen. So there's a question here that which Haron has indicated in terms of is the government engaging the people matters communication? There are all these messages that are going on around about COVID and wash your hands and physical distancing, but have the public been engaged as to how this message should be distributed, what they want to hear, how they want it phrased?
So I think there are two things. There is one that COVID, up to now, has been an element of risk communication, emergency communication, if I may. So the pace is very fast. I know in normal messaging or in normal communication, there's a bit of time. There's a bit of time to work on things. Yeah. But this thing has really been evolving. So I doubt that has really been done exhaustively given the challenge in time. But I think going forward, that is something definitely that is becoming more and more. Even from the studies that I mentioned, there's been a lot of feedback in terms of what people are doing or thinking. And I know going forward, like the second phase that they're working on will have an essence that definitely have a feedback opportunity for the people we are talking to. What do you think? Does this make sense? How might we do this? How might we phrase this? Where might we, there'll be that engagement because they've got a bit of time. And of course, there was that perceived notion that this is a passing cloud, and we sort of will do this and get done with it. But then we are saying that this is going to be the new normal. And so can we also put trigger? I think that's a challenge to the communication sector. Can we put trigger in the process and involve our target audience more so that we also get a better package for buying? So I definitely I think that's the way to go. And then thank you for that input. I think definitely doing that more in the future will ensure better buying and better messages for COVID.
Okay, There are two people who've raised their hands, even as we are almost coming to the end of this session. I'll give the platform to Athanasio, Kotonya, or Eunice Minor. Kindly unmute yourselves and you can ask your questions. Athanasio or Eunice?
Okay, thank you for that. Thank you, Dr. Ngombao, for handling that session well. So those who raised their hands and they've not been able to ask their questions, we're waiting for you, although we're winding up in the next 5 minutes. And I'd like to thank Nancy very much for handling all our many questions, but there's a very interesting question, Nancy.
Okay.
And this question is about commercial sex workers, because that is part of our target audience. So somebody is asking, what ways can we reach them as one of the high-risk groups? And this is very pertinent because yesterday in the news, they said we have 13 truck drivers who are now in Busia, Malaba border, and they tested positive. And we don't know how many they've interacted with along the way, all the way from Mombasa out to Busia. They had to stop over at some point and eat. So as we had packaged this high-risk group, not just the commercial sex workers, but also the truck drivers, how do we package the information so that they don't feel like it's something being forced into them? They take it positively and they own it, ownership. How do we make them own and make it their responsibility to make sure they don't spread the disease or they don't get the disease?
Yeah, thank you for that. Yes, I did see that question in the chat and I thought, very interesting. I think I would want to consider this like a special groups, special groups of people who might need a bit more tailored messages when it comes to them shifting behaviors to adopt what the guidelines talk about. I would say, I mean, we've had the case of the truck drivers and how better to talk to them. For them, honestly, I think more IPC, more interpersonal communication and radio. Most of them on trucks, they are likely to be listening to radio as well. And most of these groups have their own WhatsApp, they have their own formal organization, so it's an opportunity to reach them through there. HIV and commercial sex workers might be another group of interest. I've not had, like cases mentioned a lot about them, but they could be even as we go into the future. So in this space, we definitely take a lot of borrowing from HIV world in terms of communication. A lot has been done in that space. And there's a way to reach them. We know where they frequent a lot. And there has been tactical messages for those areas, be it bars, be it peer support and what have you. So it's getting them where they are. I think for every target audience, if we profile them and we are very clear about what they do, when they do it, how they do it, we are very clear about the mediums that they reach to. It is not a problem. It is definitely not a challenge reaching any cohort, any special group. I think the honors is for all of us to take a moment to just understand what they do, when they do it, and how they do it. And then we're able to talk to them because all of them can be reached. There's nobody who cannot be reached. In fact, there's a time we also had this super elite. There's a time we had a campaign and we were wondering, there's this rich cohort that is so rich, but they don't even have time for TV, and they don't watch TV. They have no time to watching TV or radio, but you can meet them at the golf course. So you take your message at the golf course. So it depends. Anyone can be reached. Just find out what they're doing, where they're doing it. Yeah.
Thank you. That's true. Anyone can be reached. We just need to find out where they are and how we can get to them. So thank you so much for that messaging. And I'd like to thank you for all the good work that you're doing. Okay, Eunice Maina, would you like to ask your question? Hello, Eunice. Okay. All right. Okay. So thank you, Nancy, for sharing your knowledge with us. Sometimes we need experts because communication is one of the topics that we're never taught in medical school. So
Right.
we are always excited to learn about these soft skills, because I think communication is one of the skills that is a basic skill. Everyone should have a way of communicating. And I like the way you put the stages of change theory, and the way you explained it so well, that what we're dealing with is change theory. And once we understand it, we'll be able to get the target audience very well. So you talked about the pre-contemplation, contemplation, preparation, the action, maintenance, and now we're going to relapse. And we're seeing the relapse has started happening. So when we get to this relapse stage as healthcare workers, or public health advocates of public health, how do we reinforce and make sure people don't relapse and completely relapse? How do we make sure the message continues being heard, being seen, and being listened to?
That was to me. All right.
Yes.
I think my comment on that is that it would follow the same process. I think the idea of relapse is not an end in itself. It is somebody who has given up on one activity due to 1, 2, 3 reasons and gone back a stage. Maybe I used to wash my hands, now I no longer feel the need. So then one of the things that become very important is the research around why people are going back. Like right now, we've seen a bit of complacency across people. Why is this? It is like, I know there are studies going around even as we speak to just understand. So messaging is always advised by evidence in terms of why are people doing the things that they are doing. If you don't crack that, then you not shift their behavior, because it's one thing to communicate, it's another thing for somebody to change their practice because of what you've told them. It must be bang on. And so I think my focus on that is that you must continuously carry out studies to find out, even if it's just talks, and they don't have to be these survey, big assessments, that are national with all those things that the methodologies that the research people tell us. It can be the one-on-one. Why are you relapsing? What is it? How can we motivate you? What are the motivators? What are the barriers around that? How can you overcome that? And so long as there's a clear benefit, this action that you're asking me to do, then and these cues, the cues that I talked about, that there's continuous support in terms of either education or media, people will go back to the same, people will continue, people will go back in maintenance of the behavior. So it's just one of those things that happen, but then there's room, there's light at the end of the tunnel, in the sense that a little bit of more effort will get people back there. We'll just get people back there where they're supposed to be. It just would mean a little bit more understanding in terms of why. If we crack the why, we will crack the behavior change.
All right, thank you for that. And the relapses we've seen is also happening in the political arena, where we're having political leaders having meetings. And there's a very interesting comment from Eric Echesa, and he's saying people tend to listen to who is saying more than what he or she is saying. So in commanding attention, I suggest political leaders, religious leaders, and artists to be used in passing messages in adverts. A Christian of Church X will pay more attention when they see or hear a leader of Church X on an advert.
Yeah.
So maybe that's one thing we need to consider, having political figures passing this message. I don't know whether that is possible, but it's something to consider, because people tend to listen to them more, especially people from their counties. If you see your governor speaking, you tend to take it a bit seriously. If he calls you for a kamkunji or the chief or the senator, you're more likely to take it a bit seriously. So we really hope that the efforts you've put in place as a team that is working on communication and packaging this message will not be diluted as the country considers reopening up. You've put so much effort, you've put so much work into it, you've put so much thought. From your slides, we can see it is not as easy as waking up and just designing a poster. We can actually see there's a lot of thought process that goes into it. Sometimes when you've not participated in some of these activities, you think it's just you wake up and you decide what colors do we have, blue, yellow, but we can see there's a lot, including how people respond to crisis. You analyze that, you analyze the community response, you target the audience, and you look at the target, you profile your audience actually. So we appreciate the lessons that we've learned from you today. They are quite informative, and we've seen it's not as easy as people think it is. Passing across a message is not as easy as we assume it is. And there's a lot of work that goes into it. So we really pray that this behavior change, which you've told us is the most difficult part, we're able to walk step by step and be able to get that to happen or to be done. And we hope your efforts will not be diluted, Nancy.
Yeah.
So
Yeah. I think also I mean, of course, thank you, and thank you this platform. And I know from even everyone else who's listening here, they know they have a role in terms of, you know, being an influencer, saying the right thing out there. And if you have an opportunity to work on a message, doing a bit of more homework behind it before it goes out, so that it can actually cause the change that it's supposed to cause. Yeah,
that's true. So thank you so much, Nancy, for that. Yeah. Any other parting shot before we end this session?
Not really. I think I've said a lot that I've said, but I think my parting shot is, even as the country opens up, we remain positive and they become the change that we want to see. And we become the people who are doing the right thing, including the guidelines that have been set up. We do not become those guys who relapse. Let's become those guys who maintain behaviors, and especially the ones that are coming from Ministry of Health. Thank you.
Thank you. Thank you so much. And I agree with you. I hope we'll not be the ones to relapse and pass on the bad behavior. I hope as we open up, the ones who are in Nairobi will not all rush now to the village to see how the village has been in the last 2 months. Because as we learned in the morning, your county is not ready. So if you, by God forbid, if you take the disease to the village and you come back to Nairobi, but you've left your parents, your relatives back at home with no structures, health system structures in place, then you've done injustice to that population. So kindly let's adhere to let's be the example. Let's lead by example, so that as we tell our neighbors, please try and contain yourself within Nairobi, wear your mask, wash your hands. We are leading by example. So thank you so much, Nancy, for this informative talk this Friday afternoon. We appreciate that you found time to come and talk to us. I'm sure we've all learned a lot. We don't take it for granted. Everybody from whatever cadre you are, I'm sure you've learned quite a lot. So we appreciate you, Nancy, for that, and the team behind you, or the team that you work with. To the rest of the participants, I'd like to thank you for attending this session. Thank you for always sparing your afternoons for these sessions. We appreciate the input that you give us in the Q&A section, in the chat box, the emails that you send. We appreciate that. I'd like to appreciate my two co-hosts, Dr. Nancy Ngumbao and Dr. Rosa Chemwei. They've tackled some of the questions you've seen in the Q&A section. And Dr. Roslyn Kinuthia has also been part of the team. So on Monday, we're going to talk to the nursing team. There's a team that has been offering care to our patients, even when we are not there, and we'd like to hear from them. So we've had in the morning session today, we've been hearing quite a lot about how the counties are prepared, the doctors give us the experience, but now we want to hear from the nursing side. So we're going to have a team from KNH, from Aga Khan University, from Coast PGH, and we're also trying to look for somebody from KU and any other county that anybody who's nursed a patient. So this is frontline workers' experience when it comes to nursing COVID-19 patients. So invite all your nursing practitioners in your facility, come and also listen to the challenges they've had and the joys and the celebrations that they've experienced. So see you on Monday at 2 p.m. Kindly also note on Tuesday and on Friday, our sessions will be at 7 p.m. Please note those two sessions. They will not be at 2 p.m. They'll be at 7 p.m. So have a good weekend and see you on Monday. Bye.